Hello to everyone. My name is Dr. Maggie Marmon, and I'm a clinical psychologist in Ottawa. Over the 4 decades of my involvement in the field of psychology, I've been passionate about and committed to our profession and the need to continue to ensure the provision of high-quality psychological services to our clients. Over the past few weeks, I've listened to and talked with many members of the College of Psychologists and Behaviour Analysts of Ontario regarding the proposed changes to the registration process. The message is clear. These proposed changes, voted on by the Council of the College to be submitted to the Ministry of Health, have created the biggest groundswell of opposition I have ever experienced. According to the College's recent survey, 89% of respondents from both the profession and the public rejected these changes. We are highly trained professionals, not generic healthcare workers, and it's time for me to speak out. You need to know that I am not here to represent any particular group or organization, professional or political. I'm not a member of the Ottawa Academy of Psychology, the Ontario Psychological Association, or the Canadian Psychological Association. I'm here simply on the length and strength of my personal involvement and experiences, and to talk about the strong sense of betrayal, deep disappointment, and sadness that I know so many of my colleagues are experiencing along with me. I've been a member of the profession of psychology since December 1984, have worked in the public sector, in hospital, school board, and university settings, and I've been in a multidisciplinary private practice in Ottawa since 1990. I was appointed to the Ontario Board of Examiners in Psychology, the profession's regulatory body, in 1991, and was the first elected president of the College of Psychologists when it was established in 1993-94. I've served as an oral examiner since 1991, have had the privilege of welcoming close to 500 psychologists and psychological associates to the profession, and have watched the process evolve over the decades, always with the protection of the public as the guiding principle for everything. Also, since 1991, I've continuously been a member of the Discipline Committee, serving as a member and chair of discipline panels and chairing pre-hearing conferences. These roles have clarified for me the weaknesses in our members that can cause psychological and emotional harm to their clients. Insufficient relevant training or expertise with different client populations or practice areas. Failure to adhere to the ethics, jurisprudence, or standards of practice. Unawareness of the limits of competence, not knowing what they don't know. A lack of understanding of boundary issues or dual relationships. Being better suited to a different career path by virtue of personal style or attitude. It is therefore crystal clear to me that reduction of the education and training requirements, elimination of the accreditation of clinical training centres, the homogenization of specialty areas and client groups, and removal of all means of objectively and independently assessing a candidate's professional maturity and readiness for autonomous practice will significantly reduce the ability of the college to assure the public of protection through a rigorous training and registration process. This version of a big, beautiful bill, which includes all these significant changes voted on in a single package, will not increase accessibility. The jobs already exist. Diluting the standards of practice to increase the number of practitioners simply means that people will be on the same long waiting lists to see less qualified psychological service providers. The only way to increase accessibility is for the government to make available more publicly funded and fairly paid positions. Otherwise, those with appropriate insurance coverage or lots of disposable income will continue to have access to private sector services. Those who don't, won't. The two-tier system is alive and well in Ontario. The current registration process is working smoothly and is continually monitored by the registration committee and staff and adapted where necessary. It isn't broken, so it doesn't need fixing or modernizing. The defence of doctoral level entry, as so thoughtfully articulated in recent well-researched articles by Dr. Nicholson, the president of the college, and Dr. De Bono, the registrar and CEO, is not about protecting a title or preserving privilege. It is, as they have both explained, fundamentally about safeguarding the public. The 180-degree turnaround from this evidence-supported direction without prior consultation and endorsement of the dramatic change in entry-level requirements have blindsided the profession, leaving many members feeling unheard, betrayed, dismissed, saddened, angry, and anxious about the future. It's particularly disheartening, to say the least, that well-respected members and organisations with decades of experience who are deeply engaged in and genuinely concerned about public safety have been accused of bias for opposing the changes. It makes it easy for me to believe that this about turn is driven by external political pressures and expediency, and that those voting on these changes may not have been fully cognizant of the reasons behind the opposition. The strong sense of betrayal that so many of us are experiencing lies in the fact that the proposed changes to training and supervision requirements have been approved by the council of the very same college that has always not just expected, but demanded an extremely high level of competence in its members. This has included accredited training programs, practica, internships, supervised placements, and ongoing quality assurance, so that the public of Ontario could be guaranteed a high standard of psychological services that they could rely upon and trust. The hoops through which new residents now have to jump have become increasingly rigorous, to the point where, if I were applying today with the qualifications I had back then, I would not be accepted. A non-clinical PhD from Carleton and a non-accredited clinical training program at the Children's Hospital of Eastern Ontario. Regardless of some discomfort and a lot of stress along the way, for me including a baby for each of my 3 degrees, we have accepted the rationale for all of these requirements and more, and in turn share them with our students, supervisees, colleagues, and of course our clients. We didn't get here because of elitism, which is based on privilege. We got here by damned hard work. My greatest disappointment comes from the elimination of the required exams. There is no common curriculum in the field of psychology, unlike, for example, medicine, dentistry, nursing. Therefore, the college has required successful completion of 2 objective written examinations, the examination for professional practice in psychology and the jurisprudence and ethics examination, and then the oral exam, which together ensure a final common pathway to registration, despite the increasingly wide variety of routes travelled to get there. As practitioners, we may have grumbled at the onerous journey, but recognise and respect the importance of a common yardstick by which readiness for autonomous practice can be determined. I've always been a fierce supporter of the orals as the only opportunity the college has of meeting each practitioner individually, assessing their clinical judgment, professional maturity, on-the-spot problem solving, daily ethical practices, not simply book knowledge, differential diagnostic abilities, and a true awareness of the range of issues related to safeguarding the public. When I see the Office of the Fairness Commissioner's comment that the failure rate of 0.3% is too low to warrant the existence of the orals, I bristle. This exam isn't about pass or fail, and I believe we ourselves must stop using those terms. It's about readiness to practice autonomously, that is, without supervision, and to be considered no threat to public safety. If someone is not deemed ready, they haven't failed. They need to continue to work under supervision until they are. The fact that 100% success is the eventual goal cannot be the reason for this part of the process being eliminated. While many others I've heard from have expressed a similar sense of grief, my own sadness comes from experiences such as I have had in the past week of oral exams, with the opportunity to meet new practitioners fresh out of their postgraduate clinical training or 4 years of supervision, and a year or more on the register for supervised practice. I am so impressed by the breadth and depth of their assessment and diagnostic abilities, their care and competence in their intervention work, and their integration of ethics and professional standards into their daily routines. Most of all, I love their enthusiasm for their chosen path, their dedication to their clients, how incredibly hard they have worked to get to that point, and the sheer joy and pride they feel when they know all their hard work and dedication have been validated and that they are finally set to go. I am sad if future members will miss this rite of passage. I shall miss it too. Finally, our integrity as a profession is under siege. It is also important to remember that the college is under siege. Having been there at its birth, I have no desire to witness its demise in the swamp of mediocrity and political expediency. We need to continue our fight for our existence, our standards, and our clients. As Dylan Thomas says, do not go gentle into the good night. Rage, rage against the dying of the light. Let's do whatever we can to keep this light shining. Thank you for listening, and goodbye.